Hey everybody, it's Ed O'Keefe. Welcome to today's show. I am here with a very special guest, Dr. Keenan Cave, and today we are going to be talking about everything surrounding dental implants and what exactly you need to know. Now, if you're someone who has missing teeth, cracked teeth, failing teeth, or even dentures and they're not fitting like they used to, or you'd like to eat the foods you love once again, or you just want a permanent solution so you can smile brighter with more confidence, I'm bringing Dr. Keenan Cave here because he is the most sought after dental implant dentist in the Indianapolis area. So, Dr. Cave, welcome to the show. How are you today?
Doing well, thank you.
Thanks for letting us crash your office. It's beautiful, and get to see the pictures of your kids, and your staff's amazing.
Yeah, thank you, appreciate it.
Why don't we start off with, obviously, the goal of today's podcast is to talk about if people want permanent smile that they can, have for pretty much forever. Mm-hmm. And there's a lot of misconceptions around dental implants. So I want to get into all the questions around that. Would you mind sharing a little bit about how you got into dentistry and just why you have a passion about helping people get dental implants and other cosmetic dentistry and family dentistry, right?
Totally. So I actually, coming out of high school, going into college, I didn't really know that I wanted to go into dentistry. Right. My dad's a dentist, my sister's a dentist, and I kind of just, I don't know if it was natural rebellion or what, but didn't want to go down that path at that time. So I went into construction, believe it or not. So
no kidding.
I was a project manager. That's what my bachelor's degree is in, because I always liked building things and fixing things and doing stuff like that. And I had some family members that were in, construction, things like that. And after I'd got into that, I realized it really wasn't for me. So my dad was like, hey, you should really give that a go, or come in and just like hang out for a day at the office. So I did it and realized that it was actually pretty cool, and kind of just took off from there. I mean, you're doing a lot of the same things in the mouth that you're doing with a building or something that is failing. You go in and you fix it and you make it better and pretty, and everybody's happy.
Yeah, I love it. Well, we wanted to have you on because we get a lot of questions on the dental side about dental implants. Mm-hmm. And there seems to be a lot of questions, and what better way to bring you on here? So I think the first thing I'd like you to do you mind just sharing 101 level, like what are the core benefits and reasons why someone should consider having dental implants, and who should be considering dental implants as an option for permanent teeth?
Totally. Yeah. So I'll start with the people that should be considering it.
Okay.
Anybody that has lost a tooth, lost all their teeth, lost a handful, it doesn't really matter. The most important things as far as them being qualified to get them, their health is obviously an issue. Anybody that's severely medically compromised, can face some complications. Obviously, we can weed people out that have those issues at that time and let them know that, hey, maybe down the road or maybe never. It kind of just depends on the situation. But the benefits, absolutely, you get your tooth back. If you have loose dentures, you can tighten things up.
My parents, when they were alive, couldn't stand their dentures.
Yeah, they're brutal.
That was the biggest thing, is like mom had to take out her partial to eat certain foods. And then she said she was always covering her mouth when at lunch or dinner with other people.
Absolutely. I mean, probably the worst fix in dentistry is a lower complete denture that is not tied to an implant. You can't use suction there because your tongue is there. It moves all over the place. It will cause sore spots. You'll bite your lips, your tongue, all those things. And now it's great because there's a great fix for it with implants. I mean, it keeps things solid. They're not moving. And I'll have patients come in that haven't eaten, a salad in years.
Are you kidding?
And we get them, fixed up with implants, and they can go have a salad the next week. I mean, it's life-changing. It keeps people healthier as well.
Yeah, that's incredible. Okay, so let's just mark that. So that's dentures. So people that have partials or dentures that move.
Absolutely.
And then something I was reading before I came in was like, if people have a bridge, and bridges last, I think on average 6 to 8 years, something like that.
Yeah, in that ballpark. Some can go a little bit longer, some a little bit shorter, depending on each patient.
Yeah, and so they're great candidates for, would it be
It can be a single tooth. It can be up to 3, 4, depending on the span of the bridge. But yeah, and you also get to keep the 2 teeth that are anchoring the bridge.
That's right.
You take all the stress off those.
Yeah.
Much easier to clean because you can floss like a regular tooth is there. The implant can't decay.
Okay.
You have very little periodontal disease that goes on with them. I'll say like 5%.
Okay.
And it's just, for hygiene purposes, considerably better. Your gum tissue, all of that stuff likes it much better.
Yeah. Okay. Very, very good. Okay, cool. So we have missing teeth. We have dentures. Who am I leaving out here? That would be great candidates for dental implants.
I think that's about it. Honestly.
That's pretty good. Okay, cool. So yeah. No, I'm just kind of like, thinking if I'm out there and I have failing teeth and want to come in and it's busy.
For sure. So anybody with, you're a person that comes in and every time that you see the dentist, you've got 5, 6 cavities, or your periodontal numbers are really, really rising. You struggle with a lot of pain from your teeth and gums, loose teeth, things like that. Yeah. It's much better to get in front of the boat on that and get things done before you've lost all of that bone, because that can pose some challenge, or can be very challenging to get back the bone, because the implant part itself, pretty simple. Yeah. The most important part is having structure around to support it.
Well, I think one of the things that you solve too, though, is that one of the core signs of accelerated aging is the shrinking of the jawbone.
Totally.
And can you address on how why implants keep the jawbone looking young and healthy and fresh?
Totally. So with aging, periodontal disease, those type of things, your body's consistently getting rid of the bone. Your body has a kind of use it or lose it mentality.
Wow. Yeah.
Patients that have lost teeth at a very young age, for whatever reason, a disease, a bad dental experience, trauma, go down the line, that bone has shrunk down to next to nothing.
Yep.
So if you get in front of that, things are considerably easier for you. Yeah. It can still be done. Sometimes it can require, a few more steps, but it will keep things going, till the end of your life, really.
Yeah, that's great. That's really great. Now with the, I had read somewhere that the nutritional factors with having without your teeth versus having dental implants or having real teeth, nutritionally, of either how we chew our food or how we absorb our food. Can you speak to that at all? Because that really grabbed my attention when I was doing some
Absolutely. Research. And that hits a lot of patients that are later in life because, a lot of times, depending on whatever health factors you have going on, your diet will change. So if you're someone that, hey, you've got to go on an almost vegan diet now, vegetables, lettuce, nuts, things like that, those are some of the hardest things to chew that you can find. Yeah. So you've got to have that to stay healthy.
Yeah. Well, and also, I was told I could never have steak ever again I know it's the opposite side of it, but like the amount of good, healthy amino acids and protein that you get from a good steak, and you can't have that. I mean, what we fight over when you get over 45 is you fight, like, especially with like men, is like you lose muscle mass.
Totally.
And so if you don't have that protein coming in.
Totally. And that's another thing too, as far as just facial features. You lose muscle mass, you lose fat in your face as you get older. If you're losing bone also, or you've already lost a lot of bone, it can give you a very frail, kind of shrunken in appearance. If you have teeth or implants that are back there supporting that bone, you don't have that issue.
Yeah. So what I'm hearing is it doesn't have to be that way. Like you can you can keep your facial features. You can eat the foods you love. You
Absolutely.
can smile. And I want to ask about financing and money here in a second, because I think there's a lot of concern over like pricing or questions around pricing. But one of the things I want to ask you before I do that is sticking to the benefits. When people come back in after they've already gone through dental implant procedure and they come back either for a recheck or they come in a month or 2 months later, what are some of the comments that they say that are consistent? Like, I didn't know this, or this is what I, am experiencing.
The number one and most important is they wish they'd done it a lot earlier.
Oh,
They're all very happy that they have that function back. It's kind of a slow burn when you're losing those things because, you very, very slowly get into a point that you're so uncomfortable you don't realize what you're missing out on.
Wow.
And once they have that function back, it's a total game changer.
Yeah.
That, and they also are kind of like, this is much easier than I'd expected as far as
it's a great point. Yeah.
The actual procedure of putting the implants in, things like that. Anybody that's ever had a tooth taken out, you've already went through a lot worse, I guess if you're going to say trauma during a surgery, than you're going to with putting the implant in.
Well, you had already said that like wisdom teeth is worse, or a lot of people say my wisdom teeth were way worse than having, like, it's not, you're talking about apples, two different experiences.
Absolutely.
Yeah.
Absolutely.
That's really interesting. That's really interesting. What's the timeline like for people? And I know it may vary, but
totally. So if you're someone that already has your teeth missing and you're getting the implants in and you don't have to do any grafting, anything like that, you're typically at about 3 to 4 months, depending on your healing.
Okay.
If you're diabetic, we'll usually wait a little bit longer because your healing's a little bit slower if there's another medical issue going on. But usually 3 to 4 months if nothing's there. If you're having a tooth taken out, most of the time we can put the implant in the same day. That's how I kind of prefer to do it.
Yeah.
That way the patients only have to go through one surgery.
Wow.
If there's a big infection or some other factor, be it health, be it financial, if you need to space it out, you can totally do that too.
Yeah.
So anybody that has a tooth taken out, implant put in the same day, we usually give them another month to heal.
Yeah.
Make sure everything's good and solid before we put a tooth on top of the implant. And that's really, 3 to 4 months. If you're having to do a sinus graft, which can happen every now and then if teeth have been gone for a long time, we usually do 6 months because the bone on top is a little bit softer than the bone on bottom. Just a little more time for it to mature.
Yeah, very good. Well, you started talking about spacing out. So this brings us to financing, because one of the big questions people, like when I was thinking about like dental implants, price, expensive. So I just kind of want to address that in straight on is, let's walk through the different ranges of fees, and then what are the options for patients? Because obviously they're out there, they're doing the research, and they're looking for a practice they can trust.
Totally. So I'll see a lot of, thinking about doing research, I see a lot of ads that have a bunch of crazy prices and things on them. They're kind of ridiculous because most docs usually, you're probably around 5,000, 5,500 for a single tooth replacement. A lot of patients will think, oh my, I had 30 teeth, 32 teeth, however many, and you've got to do that times 5. That's not the case.
That's a good thing. Can you expand on that a little bit? That's really good to know.
So if you're a patient that doesn't have any teeth, or you have a partial, full denture, whatever, you only typically will need 4 implants to do a full arch on the top and bottom. It's always nice if you can do 1 or 2 more. That is just, more support for the prosthesis, depending on your bite, a few other factors. You may need, up to 6. I've seen people that have 8. It's not always necessary, but it gives you some variability down the road on, if anything would happen. So
okay, and you put a full denture on top, or a denture on top of that. That's what okay, cool.
Yes.
So if I get 4 implants, then I put a denture on top of that and it locks it in. Which is completely unlike what we talked about before, which is removable dentures. You lose all that and you're dealing with a different issue.
Absolutely. And with the other great thing about implants that I didn't mention earlier, they don't put stress on your other teeth. With a partial, with a bridge, you're putting stress on the other teeth that can sometimes lead to some issues. So.
Okay, cool. So then, this is great to know. And then, 5,500 so you could be looking at, if I need 1 implant, 5,500 to say 6 implants, it might be around $30-something thousand.
If you're doing a full arch, usually the top side of that is about $30,000. You can have that done for as little. And that's, keep in mind, if you're starting from nothing. If you come in and you don't have a denture in hand, you don't have anything. You've got gums and a jaw.
Okay.
That's when you're going to be at that 30,000-ish mark. If you already have a denture, there's a lot of times we can retrofit that to implants. Sometimes we can't, kind of depends on the current denture. The other thing we can do, there's a couple different types of implant-supported dentures. So one is bolted on there, much like you would bolt, a picture on the wall, what have you, that you come see us every 6 months. We take it off, clean everything out, make sure things are great. There's another kind that is you can remove each night at home, and it utilizes some fittings that kind of snap on. So it's solid all day long, but then if you need to clean or you need to do anything, pop it out, clean it at home, pop it right back in, you're good to go.
Okay, great.
And those are typically, they can be anywhere from $15,000 to $20,000 depending on what type of denture that you have made, if you need one made, or how many implants are there that you have to do fittings for.
Okay, awesome. So then this leads me to my question on financing and options. So some people might come in, pay for it. That's not most people, right? So you have people that are doing financing it just like they would their car or whatever it might look like. What financing options are available, and what do people need to know about it?
So we use a handful of different financing companies. We can do Care Credit, we can do Lending Club, Proceed Finance, Sunbit we've used. There are a few different ones. They make it really nice because you can space it out. And I mentioned earlier how there's, there can be a 3 to 4 month wait, possibly 6 between whenever you have the implants put in and then whenever you load them up with a denture or a tooth. There's no harm if you need to spread that out financially, and if you need to wait, you can totally do that. It doesn't hurt the implants or anything like that. The other thing that you can do is if you're just doing a single tooth, you could do that. You could wait a year, put the tooth on it, kind of push it out as far as you need to.
Yeah, I think that's why I want to talk to you about the financing, because there's confusion around that, right? Like most people don't realize that you can actually set goals with your dental health, and that they could work with you on what they need to, like, hey, maybe we don't have the cash to just write a check for $30K.
Yeah, it's a big chunk.
But we can get started today with this and work with you, and your team will work with the financing companies to make sure they get to know all their options.
Absolutely.
Okay.
Absolutely.
Now, I did want to bring up, just because so everyone knows, like the credit score to get finance nowadays, just now, it needs to be, is it over 600? Is it, what do you?
I want to say it's between 650, 700,
Okay.
I think.
So 650, just so you know, if you're out there, you're like, well, I don't know if I qualify or not. Like if you're under 650, you're welcome to call the office. But if you don't have a cosigner or cash to pay, you're most likely not going to get approved. But over 650, definitely like come on in.
Absolutely.
And see how they can work with you on what procedures are necessary and
Absolutely.
and what we can do for you on that. That's great. Okay, cool. So let's talk about some of this. Is there anything else you want to talk about on the financing side that I might be? Oh, let's talk about insurance and Medicaid, because I know that gets brought up a lot in your office.
Totally. Typically, Medicaid will not cover these type of procedures because they kind of think, hey, you've got a regular denture.
Yeah, right.
You're
just
fine.
Don't do it.
Yeah, totally. Yeah. And after having one of those, you're not fine because they're difficult to use. So they typically don't help out too much. There are some insurance companies that will, especially on single teeth.
Yeah.
And we can check all that out for you.
Right.
Make sure that everything's a go before you make any sort of decision.
Yeah, that's great. Yeah, I mean, you might as well see what they can do.
Yeah,
and not
no harm in finding out.
Versus getting it financed. That's right. Now, how painful is it? I know we addressed this a little bit, but how painful is it to have dental implants put in?
Absolutely. So the patients that come in and are kind of the most excited, kind of hyped up.
Yeah, I want to talk about that.
Yeah, they're thinking, oh my God, I'm undergoing this huge thing. Leave completely underwhelmed because it's kind of like, man, that was it.
Yeah.
And there's a lot of times where you don't even have to get the full arch numb to do it.
Wow.
It's a local anesthetic. Yeah. The bone that you're going into, in 75% of the areas, there's no nerve anywhere near. So theoretically, if you didn't have gum tissue, you could have the thing done without anesthetic.
Yeah.
The anesthetic is mainly for your gum tissue when you're moving in, because you have nerve endings and things. But it is, as far as surgery goes, it's one of the least painful, least post-op kind of pain things that you're going to deal with.
Yeah. Okay. Are there any warranties on the procedures?
Typically, if you have problems with something within 5 years, we typically will take care of it.
Yeah. Okay, great. Now, what would be, I know we talked about, I'll skip that question because I'll ask you it later, but I guess what would be the first step? So they watch this interview.
Totally.
They're either in the Indianapolis area, which I know, I live in Chicago, so this is a good 2.5 hour drive. If it's to choose the right office, to be with the right people,
totally,
and be comfortable, that's not a long drive for something this important.
Absolutely.
Right? So, one question I want to ask you about the payments though is when people get financed, what are typical payment amounts per month that they may see? And I know it's a range, but
totally. Obviously, if you're doing a $25,000 full arch, you're going to have higher payments.
Okay.
The other, I guess, variable with that is how long do you want to push it out?
Oh,
I know that some of the patients, if they're like, hey, I want to get this done and have it paid off within a year, there's no interest on a few.
Oh wow, that's right. That's right.
Really nice. So it can be fairly low.
Yeah. Like a mattress.
Yeah. Right. Yeah.
Free mattress, no interest.
Totally. So you can be anywhere from $200 a month to $1,000, depending on $1,000 if you want that. Kind of just depends where you're at.
Which a brand new Tesla is $650 to $1,200 a month. So
right.
It's less than car payments.
Absolutely.
In a lot of cases. So you heard that here first, folks. If you want a brand new permanent smile that allows you to eat the food you love once again, to get your youth back or even restore it, as you're growing, it could be as little as $200,000 a month or less, depending on your procedure. So that's awesome. This is great. I think most people are confused by that, because when I was doing research on the most commonly asked questions people have, it's always like, are dental implants expensive? And I always like to say to people, like, expensive is based on what you're comparing it to.
Totally.
Right? Like, I mean, for you to be able to enjoy the food you love, smile with the people you like, never have to worry about dentures or something flipping out of your mouth, or...
Well, that, and I mean, if you go down and you price all these things out at different clinics, they're not necessarily all created equal. So if you go with a super, super budget-friendly option, good chance you're going to have trouble with that down the road, and then you're going to pay for that and what you need in the future. Yeah, totally. Point. So it's definitely something that you want to think a lot about, before you invest in that.
Okay, great. So if I wanted to come in, visit Ameriplex Family Dental Care, meet with you, get a consultation, what does that look like? I mean, obviously I would call the office, right?
For sure. So you would give the office a call, come in. The very first thing that we'll typically do, sit down, get an idea of what it is that you want.
Yeah, what are your goals, right?
Yeah, find out your goals, see what we can do to get there. We'll take a CT scan and basically quantify how much bone that you have, make sure that you've got everything that you need to support it. If not, what are you going to need to get that support?
Right.
We'll figure that out, and we'll give you a treatment plan, and we can obviously check with insurances, check with finance companies. We can do all of those things here, and then kind of go from there based on what you want to do.
And what does it cost for a free or a consultation?
We don't charge anything.
Okay, so it's free. It's no cost. Yeah. I mean, so that's pretty amazing. And what I like about what we talked about even before we jumped on is that, like, the patient's in control. They get to you're working and facilitating them getting that end result.
Totally. I mean, and there's no pressure in any of this stuff. No one really likes going to a car dealership and being pressured into buying.
That's
a
right.
car.
That's right.
It's a big choice. It's uncomfortable. It's something that if you want to do it, great, we can do it. We'll find a way to get there. If not, that's okay too.
Yeah, and your team's lovely. The guilt-free component I love, because most people grew up with dentists that were very like, oh, we haven't seen you in 6 months.
Yes, I have never understood that.
Yeah. So if you have any of those fears, you can set them aside. And I'd love to have you just give Dr. Keenan a call and his team at Ameriplex Family Dental Care. Would you like to give the number real quick? I know we're going to have it probably somewhere around here.
Sure, 317-856-5544.
Yeah, and then come on in, do the free consultation, and find out how they can help you today so that you can smile, live with confidence, and if this is something you've been looking to do, you found a home right here with these guys.
Yeah, so. Absolutely.
Well, it was great having you on the show.
Yes, thank you very much. Hope I answered some questions.
You were amazing. So that's it, everybody. Thanks for watching the show. Hope to see you on the next one and hear from you soon. Thanks.